Hi, my name is Tia Shorter, and I'll be talking about my project, the functionalization of chondroitin sulfate on medical SNAP blended polymers for improved anti-fouling and antithrombotic properties. So, some background, blood contacting medical devices, specifically intravenous catheters, are widely used in healthcare. Over 5 million CVCs are used, and over 200 million PIV catheters are used. But the two common healthcare issues are service-induced thrombosis and bacterial infections. Now, many factors can result in catheter-related thrombosis or CRT, which can be due to the catheter type, placement location, or patient history. And the most that causes material surface interface is where the blood is in direct contact with the medical device. That's where the most cause is. Sorry. As a result of CRT, there is an increased risk of catheter-related bloodstream infections known as CRBSIs. Common pathogens are S. aureus and Pseudomonas aeruginosa. Now, these SRBSIs can lead to increased hospitalization, increased healthcare costs, intensive use of antibiotics, and even mortality. Now, some common and current treatments include systemic administration of heparin or heparinized surfaces, but with the use of heparin, this can cause HITs, known as heparin-induced thrombocytopenia, and excess bleeding. And there are also patients that are resistant to heparin, as well as with antibiotic administration for treating bacterial infections, but this can be ineffective due to antibiotic resistance. Ultimately, there is a need for an alternative hemocompatible material capable of preventing thrombosis as well as preventing bacterial infections. And that is where my material comes in. So chondroitin sulfate C and chondroitin sulfate B, they bring a new outlook to anticoagulation. They are low fouling, so they result in low platelet adhesion as well as low protein absorption. They are selective towards thrombin inhibition, they have less hemorrhage effects, and they do not cause HIT. So in combination with nitric oxide, this will help with hemocompatibility, improve it, as well as help with treating thrombosis. So as for some data, we used polydopamine chemistry to successfully mobilize CSC and CSB onto the surface of Elastion, polyurethane material. In A, the contact angle, you can see that over time, or with the addition of the anticoagulants, it does create a hydrophilic surface, which aids in hydrophilicity. That you see in B, the wetting of the water droplet spreads, and in C, FTIR confirms that indeed we have the CSC and CSB on the surface with the stretch of OH groups and carboxylic acid groups. As for immobilization content, around 5 micrograms was immobilized for CSC on both films, and around 6 or 7 micrograms per centimeter squared was immobilized for CSC. It was observed after 48 hours of leaching, around 30% of the anticoagulants was leached. And for hemocompatibility, it will be proved that platelet adhesion was in fact reduced with CSC and CSB compared to their respective controls, and protein absorption using fibrinogen adhesion assay. Again, the absorption of fibrinogen was reduced with CSB and CSC immobilized to the surface with respect to the controls, and the hemolytic index proved that the surface was not toxic towards red blood cells if indeed it is implanted in the body and is in contact with red blood cells. So in conclusion, this was a fascial way of immobilizing CSC and CSB onto the surface using polydopamine chemistry. It was stable, showing that after 48 hours, more than 70% of the anticoagulant was remaining. We did do interreleasing studies that lasted more than 7 days. They were also not cytotoxic after 24-hour treatment, and they indeed enhance antifoulant and antiplatelet behavior.